If you're over 50, your liver could be in serious trouble without you feeling any pain at all. Unlike other organs, the liver often stays silent while damage is already happening. Many people dismiss the early warning signs as normal aging, stress, or digestive problems. But by the time symptoms become obvious, liver damage may already be advanced and difficult to reverse. Fatigue, stomach discomfort, skin changes, or unexplained weight shifts are not just minor issues. They may be your liver asking for help. In this video, you'll learn 5 critical liver warning signs people over 50 should never ignore, and why recognizing them early could protect your health and possibly save your life. As we get older, the liver becomes more vulnerable than most people realize. After the age of 50, years of daily habits begin to add up. Medications, processed foods, alcohol, environmental toxins, and underlying health conditions can quietly place constant pressure on the liver. Even people who feel healthy and rarely get sick may already have early liver damage without knowing it. One of the most dangerous things about liver disease is how silent it can be. The liver has an incredible ability to keep functioning even when a significant portion of it is already damaged. Because of this, symptoms often develop slowly and appear mild at first. Many people ignore them or assume they are just part of getting older. The liver plays a critical role in the body. It filters toxins from the blood, helps digest fats, regulates blood sugar, stores vitamins and minerals, and supports hormone balance. When the liver begins to struggle, the effects are not limited to one area of the body. Problems can show up in your energy levels, digestion, skin, weight, and even your mental clarity. For people over 50, liver damage is often linked to conditions such as fatty liver disease, long-term medication use, diabetes, high cholesterol, or past alcohol consumption. In many cases, the damage develops quietly over years. By the time severe symptoms appear, the liver may already be under serious stress. This is why awareness is so important. Recognizing early warning signs gives you the opportunity to take action before permanent damage occurs. Simple lifestyle changes and early medical evaluation can make a meaningful difference when liver problems are caught early. This video is created to help people over 50 understand what their body may be trying to communicate. It is not meant to diagnose disease or replace professional medical advice. Instead, the goal is to increase awareness and encourage informed conversations with healthcare providers. If you notice symptoms that are new, persistent, or worsening over time, especially when several signs appear together, they should never be ignored. The liver often sends quiet signals before more serious complications develop. In the next sections, we'll go through 5 liver warning signs that people over 50 commonly overlook. Each of these signs may seem harmless on its own, but together they can point to significant liver stress. Understanding them could help you protect your health and take action at the right time. Let's begin with the first liver warning sign. One of the earliest and most common liver warning signs in people over 50 is persistent fatigue. This is not the normal tiredness that comes after a long day or improves after a good night's sleep. Liver-related fatigue feels deeper, heavier, and more constant. Many people describe it as feeling drained no matter how much they rest. As we age, it's easy to blame low energy on getting older. People often assume fatigue is caused by poor sleep, stress, or a busy routine. While these factors can contribute, ongoing fatigue that lasts for weeks or months may signal that the liver is struggling. The liver plays a major role in converting nutrients from food into usable energy. It also filters toxins from the blood. When the liver becomes overloaded or damaged, toxins can begin to build up in the bloodstream. This puts extra strain on the entire body and can leave you feeling physically and mentally exhausted. People over 50 with liver-related fatigue often notice that everyday tasks feel harder than before. Activities like walking short distances, climbing stairs, doing household chores, or running errands may leave you feeling unusually tired. You may find yourself needing more frequent breaks or losing motivation to stay active. Mental fatigue is also common. Some people experience difficulty concentrating, forgetfulness, or a sense of mental fog. You may feel slower in your thinking or have trouble focusing on conversations, reading, or simple decision-making. This happens because toxins that are normally cleared by the liver can begin to affect brain function. Another important detail is how this fatigue progresses. In the early stages, it may come and go. You might feel better some days and worse on others. This inconsistency makes it easy to ignore. Over time, however, fatigue often becomes constant and starts to interfere with daily life. Sleep may no longer feel refreshing. Even after several hours of rest, you may wake up feeling just as tired as before. Naps may provide little relief. This is a key difference between normal tiredness and liver-related fatigue. Some people also notice mood changes alongside fatigue. Irritability, low motivation, anxiety, or mild depression can appear. These emotional changes are often overlooked, but they may be linked to liver stress and toxin buildup. Fatigue related to liver problems is often worsened by certain medications. Many commonly used drugs, such as pain relievers, cholesterol medications, and some prescription treatments are processed by the liver. Long-term use, especially after the age of 50, can increase liver strain and contribute to persistent low energy. Diet also plays a role. Diets high in processed foods, sugar, and unhealthy fats can make liver-related fatigue worse. Alcohol consumption, even at moderate levels, can further stress the liver and amplify feelings of exhaustion. It's important to pay attention if fatigue is accompanied by other symptoms, such as digestive discomfort, loss of appetite, nausea, or changes in weight. When multiple symptoms appear together, the likelihood of liver involvement increases. Warning signs related to fatigue that should never be ignored include fatigue lasting longer than a few weeks, feeling tired even after adequate rest, needing more effort to complete simple tasks, mental fog or trouble concentrating, fatigue combined with digestive or skin changes. These combinations suggest that fatigue may not be harmless. While fatigue can be caused by many conditions including anemia, thyroid disorders, sleep apnea, or depression, liver-related causes should always be considered, especially in people over 50. Ruling out liver stress early can help prevent more serious complications. The good news is that fatigue is often one of the earliest warning signs. When liver problems are identified early, lifestyle changes and medical guidance can significantly improve liver function and energy levels. If you are experiencing persistent low energy without a clear explanation, the safest step is to speak with a healthcare professional. Simple blood tests can help assess liver function and identify potential problems before irreversible damage occurs. Fatigue should never be automatically dismissed as a normal part of aging. For many people, it is the body's early signal that the liver needs attention. Next, we'll move on to warning sign number 2, another liver symptom that commonly affects digestion and appetite and is often overlooked in people over 50. Another major liver warning sign that people over 50 often overlook involves digestive problems and changes in appetite. Because digestion issues are so common, many people dismiss them as stomach trouble, food sensitivity, or part of aging. However, persistent digestive symptoms can be one of the clearest early signals that the liver is under stress. The liver plays a critical role in digestion by producing bile. Bile helps break down fats and allows the body to absorb essential nutrients such as vitamins A, D, E, and K. When the liver is not functioning properly, bile production or bile flow can be disrupted. This directly affects how well food is digested. One of the first signs people notice is frequent bloating or gas, even after eating small meals. You may feel uncomfortably full shortly after eating, or experience pressure in the upper abdomen. Some people describe a constant sense of heaviness after meals, rather than sharp pain. Nausea is another common symptom. This may occur in the morning, after eating fatty foods, or seemingly without a clear trigger. Unlike food poisoning or stomach flu, this nausea often lingers and returns repeatedly. Over time, it can reduce interest in food altogether. Loss of appetite is especially concerning in people over 50. You may notice that foods you once enjoyed no longer appeal to you. Meals may feel like a chore, or you may skip meals without feeling hungry. This can lead to unintentional weight loss and nutritional deficiencies. Some people experience changes in bowel habits. Stools may become greasy, oily, or difficult to flush. This happens when fats are not being properly digested due to reduced bile flow. Others notice stools becoming lighter in color or irregular in shape. While many people rarely pay attention to stool changes, these signs can provide valuable clues about liver health. Digestive discomfort related to liver problems often worsens after eating fatty, fried, or heavily processed foods. Alcohol can also intensify symptoms. Even small amounts may trigger bloating, nausea, or abdominal discomfort when the liver is already strained. Another overlooked symptom is a bitter or metallic taste in the mouth. Some people also experience frequent burping or acid reflux that does not respond well to typical treatments. These symptoms may be misdiagnosed as acid reflux or gastritis when the underlying issue involves the liver. Because digestive symptoms often come and go, they are easy to ignore. You may feel better for a few days, then worse again. This pattern can delay diagnosis and allow liver damage to progress quietly over time. It's important to pay close attention if digestive issues persist for several weeks or longer, occur consistently after meals, are triggered by fatty or heavy foods, are accompanied by nausea or appetite loss, come with unexplained weight changes. When these signs appear together, they should never be ignored. Digestive symptoms related to liver stress can also affect blood sugar regulation. Some people experience sudden drops in energy after meals, shakiness, or cravings for sweets. This happens because the liver plays a role in maintaining stable blood sugar levels. Medications can further complicate digestive symptoms. Many drugs commonly used after age 50, such as pain relievers, antibiotics, and cholesterol medications, are processed by the liver. Over time, this can contribute to digestive discomfort and appetite changes. While digestive problems can also be caused by stomach ulcers, gallbladder disease, or intestinal conditions, liver-related causes should be considered, especially when symptoms are persistent and unexplained. If you notice ongoing digestive discomfort or a loss of appetite that lasts more than a few weeks, it's important to speak with a healthcare professional. Blood tests and imaging can help determine whether the liver is involved. Digestive problems are not always harmless. In many cases, they are one of the body's earliest ways of signaling liver stress. Next, we'll look at warning sign number 3, which often appears on the skin and in the eyes, and can provide visible clues about liver health. Changes in the skin and eyes are among the most visible warning signs of liver problems, yet many people over 50 overlook them or assume they are related to aging, allergies, or skin conditions. Because these signs often develop gradually, they are easy to dismiss until liver damage becomes more serious. One of the most well-known liver-related signs is yellowing of the skin or the whites of the eyes, a condition known as jaundice. This occurs when the liver cannot properly process bilirubin, a waste product created when red blood cells break down. When bilirubin builds up in the bloodstream, it causes a yellow tint in the skin and eyes. Jaundice does not always appear suddenly or dramatically. In early stages, it may be subtle. Some people notice a slight yellow tone in natural light, or family members may point it out before the person notices it themselves. Because it may not cause pain, it is often ignored. However, jaundice is not the only skin-related warning sign. Persistent itching without an obvious cause is another common symptom. This itching can affect large areas of the body and may be worse at night. It often does not improve with lotions or allergy medications. Liver-related itching occurs when bile salts build up in the bloodstream and irritate nerve endings in the skin. Another important sign is the appearance of spider-like blood vessels, often seen on the chest, neck, face, or shoulders. These small red or purple veins resemble spider webs and can indicate changes in blood flow caused by liver dysfunction. While a few spider veins can be normal, a sudden increase should raise concern. Some people notice redness on the palms of the hands, known as palmar erythema. Others experience darkening of the skin in certain areas, such as the neck or underarms. These changes are linked to hormone imbalances that can occur when the liver is not functioning properly. Easy bruising is another warning sign that often goes unnoticed. If you begin to bruise more easily than before, or notice bruises appearing without injury, it may indicate that the liver is not producing enough clotting proteins. This can increase the risk of bleeding and signal declining liver function. Changes in nail appearance can also provide clues. Pale nails, ridges, or white discoloration may reflect underlying liver issues. In some cases, the nails may appear brittle or grow more slowly than before. People over 50 may also notice that their skin becomes unusually dry, dull, or sensitive. Cuts and bruises may heal more slowly. These changes can occur because the liver plays a role in nutrient storage and circulation. When liver function declines, the skin may not receive the nutrients it needs to stay healthy. Eye-related changes extend beyond yellowing. Some people experience dryness, irritation, or increased sensitivity to light. While these symptoms can have many causes, they should not be ignored when they appear alongside other liver warning signs. It's especially important to pay attention when skin or eye changes appear together with symptoms such as fatigue, digestive problems, or abdominal discomfort. Multiple symptoms occurring at the same time increase the likelihood of liver involvement. Warning signs related to the skin and eyes that should never be ignored include yellowing of the skin or eyes, persistent itching without a clear cause, spider-like blood vessels on the skin, red palms or darkened skin patches, easy bruising or slow healing, changes in nail color or texture. When these signs persist or worsen, they deserve medical attention. One reason these signs are often missed is that they can come and go. Symptoms may improve temporarily, leading people to believe the issue has resolved. In reality, liver stress may still be present beneath the surface. Medications, alcohol use, and long-term exposure to toxins can all contribute to liver-related skin changes. After age 50, the liver may not recover as quickly as it once did, making these signs more significant. While skin and eye changes can also be caused by dermatological conditions, allergies, or infections, liver-related causes should always be considered, especially when symptoms are unexplained or persistent. If you notice ongoing changes in your skin or eyes, a healthcare professional can perform blood tests and examinations to assess liver function. Early detection can help prevent progression to more serious liver disease. Visible changes on the skin and eyes are often the body's way of signaling internal distress. Listening to these signals can make a critical difference. Next, we'll discuss warning sign number 4, which involves abdominal discomfort and swelling, and is often mistaken for simple bloating or weight gain. Another serious liver warning sign that people over 50 often overlook is ongoing abdominal discomfort, pressure, or swelling, especially on the upper right side of the abdomen. Because this sensation is rarely sharp or severe at first, many people dismiss it as bloating, indigestion, or simple weight gain. The liver is located in the upper right portion of the abdomen, just beneath the rib cage. When the liver becomes inflamed, enlarged, or congested, it can create a dull ache, heaviness, or uncomfortable pressure in this area. Unlike stomach pain, liver-related discomfort often feels vague and difficult to describe. Many people report a feeling of fullness or tightness rather than pain. You may notice discomfort when bending over, sitting for long periods, or lying on your right side. Some people feel pressure after eating, even if the meal was small. Because these sensations are mild at first, they are easy to ignore. As liver stress progresses, abdominal symptoms may become more noticeable. In some cases, the abdomen may begin to visibly swell. This can happen when fluid accumulates in the abdominal cavity, a condition known as ascites. Ascites develops when liver damage affects blood flow and fluid regulation. People with abdominal swelling may notice their clothes fitting tighter around the waist, even without changes in diet or activity. The scale may show sudden weight gain that does not reflect increased body fat. This type of weight gain is often confusing and alarming. Abdominal swelling related to liver problems often develops slowly. Because of this gradual progression, many people attribute it to aging, reduced activity, or digestive sensitivity. Unfortunately, by the time swelling becomes obvious, liver damage may already be significant. Some people experience discomfort that comes and goes. On certain days, symptoms may seem mild or absent, leading to a false sense of reassurance. On other days, pressure or swelling may feel worse. This pattern can delay medical evaluation and allow liver disease to advance silently. Another related symptom is tenderness in the upper right abdomen. You may notice discomfort when pressing on the area or during physical activity. While this tenderness is often mild, it can be an important clue that the liver is inflamed. Abdominal discomfort can also be accompanied by nausea, reduced appetite, or early fullness during meals. These symptoms often overlap with digestive warning signs, making it difficult to pinpoint the cause without proper evaluation. Pay close attention if abdominal symptoms persist for several weeks or longer, are focused on the upper right side, feel like pressure or heaviness rather than sharp pain, are accompanied by bloating that does not improve, come with unexplained weight gain or fatigue. These combinations should never be ignored. Alcohol consumption can significantly worsen abdominal symptoms related to liver stress. Even small amounts may trigger discomfort or swelling in people whose livers are already compromised. Certain medications can also contribute to fluid retention and liver inflammation. Physical inactivity can make abdominal swelling more noticeable as circulation and fluid balance are affected. However, even active individuals can develop liver-related abdominal symptoms if underlying liver disease is present. It's important to understand that abdominal swelling is not just a cosmetic issue. When fluid builds up due to liver dysfunction, it can increase pressure on internal organs and interfere with breathing, digestion, and circulation. While abdominal discomfort can be caused by stomach ulcers, gallbladder problems, intestinal conditions, or muscle strain, liver-related causes should always be considered, especially when symptoms are persistent, unexplained, or progressive. Healthcare professionals can evaluate abdominal symptoms through physical exams, blood tests, and imaging studies such as ultrasound or CT scans. Early detection can help prevent progression to more severe liver disease. Ignoring abdominal discomfort or swelling allows liver stress to continue unchecked. Listening to these signals and seeking evaluation early can make a meaningful difference in long-term health outcomes. Next, we'll move on to warning sign number 5, the most dangerous and often ignored liver warning sign in people over 50. The fifth and most dangerous liver warning sign in people over 50 involves changes in urine color, stool appearance, and unexplained weight changes. These signs often indicate that liver function is already significantly impaired, yet many people ignore them or fail to connect them to liver health. One of the earliest signs is dark-colored urine. Instead of the normal pale yellow color, urine may become dark yellow, amber, or even tea-colored. This happens when the liver is unable to properly process bilirubin, causing excess bilirubin to be excreted through the urine. Many people assume dark urine is simply a sign of dehydration, but when it persists despite proper hydration, it should raise concern. At the same time, stools may change in appearance. Pale, clay-colored, or gray stools can indicate reduced bile flow from the liver into the digestive system. Because bile gives stool its normal brown color, changes in stool color are an important clue that the liver or bile ducts may not be functioning properly. Unfortunately, many people rarely pay attention to stool color. Changes may go unnoticed for weeks or months, allowing liver damage to progress silently. When dark urine and pale stools appear together, they strongly suggest liver involvement and should never be ignored. Another serious warning sign is unexplained weight changes. Some people experience sudden weight loss without trying. This can occur due to reduced appetite, poor digestion, or difficulty absorbing nutrients. Others may experience rapid weight gain, often caused by fluid retention rather than increased body fat. Fluid-related weight gain may be subtle at first. You may notice swelling in the abdomen, legs, or ankles, or see the number on the scale increase without changes in diet or activity. This type of weight gain can be confusing and is often misattributed to aging or inactivity. These weight changes are particularly concerning when they occur alongside fatigue, digestive problems, or abdominal discomfort. Multiple symptoms appearing together increase the likelihood that the liver is under significant stress. Additional symptoms may include nausea, a general feeling of illness, or a decrease in overall strength. Some people report feeling unwell without being able to pinpoint exactly why. This vague sense of discomfort is common in advanced liver stress. Pay close attention if you notice dark or tea-colored urine, pale, gray, or clay-colored stools, sudden weight loss without changes in diet, rapid or unexplained weight gain, swelling in the abdomen or lower body. These combinations require prompt medical evaluation. These warning signs are especially dangerous because they often appear later in the course of liver disease. By the time they become noticeable, liver function may already be significantly compromised. Ignoring them can lead to serious complications such as cirrhosis or liver failure. While medications, supplements, or certain foods can sometimes affect urine or stool color, liver-related causes should always be ruled out first, especially in people over 50. Assuming these changes are harmless can delay diagnosis and treatment. If you notice persistent changes in urine color, stool appearance, or unexplained weight fluctuations, it's important to consult a healthcare professional as soon as possible. Blood tests, imaging studies, and other evaluations can help determine the cause and guide next steps. Listening to these warning signs and acting early can help prevent irreversible liver damage and protect long-term health. If you recognize one or more of these liver warning signs, the most important thing to do is not ignore them. Liver problems often progress quietly, and waiting too long can allow damage to become difficult or impossible to reverse. Early attention can make a major difference. Start by observing your symptoms carefully. Pay attention to when they began, how often they occur, and whether they are getting worse over time. Symptoms that last more than a few weeks, especially when several appear together, should always be taken seriously. The next step is to speak with a healthcare professional. Simple blood tests can provide valuable information about liver function. In some cases, imaging tests such as an ultrasound may be recommended. Early evaluation does not mean something is seriously wrong, but it allows problems to be identified before they become severe. Protecting your liver also involves daily habits. Limiting alcohol intake is one of the most important steps you can take, especially after age 50. Even moderate alcohol use can place strain on a liver that is already vulnerable. Maintaining a balanced diet with fewer processed foods and added sugars can also help reduce liver stress. Physical activity supports liver health by improving circulation and helping regulate blood sugar and fat metabolism. You don't need intense exercise, regular walking, and light movement can make a difference. Managing conditions such as diabetes, high cholesterol, and obesity is also critical, as these conditions are closely linked to liver disease. Be cautious with medications and supplements. Many substances are processed by the liver, and long-term or excessive use can increase liver strain. Always follow medical guidance and avoid unnecessary medications. In urgent situations such as severe abdominal swelling, confusion, or sudden worsening of symptoms, seek medical care immediately. These may signal advanced liver complications. Let's quickly review the 5 liver warning signs people over 50 should never ignore. Persistent fatigue and low energy, ongoing digestive problems and loss of appetite, changes in the skin and eyes, abdominal discomfort or swelling, and changes in urine color, stool appearance, or unexplained weight changes. Individually, these symptoms may seem minor. Together, they can signal serious liver stress. Paying attention to these early signs gives you the best chance to protect your liver and maintain your quality of life as you age. If this video was helpful, consider liking it and sharing it with friends or family over 50 who may benefit from this information. Awareness can truly make a difference. Be sure to subscribe for more videos focused on early warning signs and healthy aging. In our next video, we'll cover another important health topic people over 50 should never ignore. Thank you for watching. Take care of your liver and take care of your health.